our outpatient department, we have outpatient clinics which are supported by radiology, lab and pharmacy. Outpatient dental clinics are also really headed by professors like Professor David Rashid as well as Professor Saqib, who are there for our dental care of the patients. In the outpatient department, we do have an oncology daycare center, which is a recent addition. We do give chemotherapies, etc. in our oncology unit, which is very clean, personalized, taking care of all the patients who have recently been diagnosed with cancer and treated, and they need a follow-up care. We also have a gastroenterology suite next to our outpatient department where patients come in as daycare for endoscopies, upper and lower GI endoscopies. We do have a hair salon or beauty salon for the patients who want to go and avail the services, as well as for our staff. And for the visitors who are waiting in the outpatient department can have a quick hair blow dry or perhaps smaller services for especially female patients. Apart from that, we have a vaccination center which has been very active during COVID for COVID vaccination. We are giving seasonally vaccinations for pneumonia, vaccinations for typhoid, vaccination for hepatitis, whatever is the EPI recommendation. It is in collaboration with the government of Sindh that we do provide the vaccination services all around the year. Our physiotherapy department is very well equipped by our trained physiotherapists, and we also have a school of physiotherapy where our students and our interns are also participating in our physiotherapy program, which is fairly robust and very effective. We are also planning to provide home care physiotherapy services in future. Our vision is to provide drug and alcohol rehab, because whenever you are setting up a healthcare facility, you go according to the prevalence of the disease. I would say that there's a much lesser prevalence of cancer as compared to drug or substance abuse, as compared to alcohol addiction. So that's a field that has been neglected, and we are working, and we are soon going to open a drug and alcohol rehab unit for our students, for our women, for our men, so that they can be rehabilitated and they go back to the society in a healthier condition. Apart from that, elderly care unit is also not that well developed in this country. So we do feel very sensitive towards the need for providing an elderly care unit, where many overseas Pakistanis who are living abroad are concerned about their parents, that they've installed cameras at home, they don't have good healthcare providers. So we do plan to open a unit for elderly care, for well elderly care, where the parents are here and the kids are overseas. Apart from our clinical services, one of the major ones that I must mention is our Department of Radiology, which is state of the art. You can buy any machine on leasing, or you can buy it, but it's the man behind the machine that matters. Dr. Wasi Jalani is one of our top interventional radiologists who has not only excelled, who has revolutionized the radiology care in terms of his quick reporting, in terms of services, what is the experience. The top thing that he has acquired is for certain cancers, interventional radiology plays an important role. For hemorrhages, interventional radiology has come to our rescue for embolization, etc. And recently we have done certain cases which has been an eye-opener. 3 occasions I can quote where patients came in with massive pulmonary embolism, which has a 99% mortality. And Vase took the initiative and took them to the cath lab and dissolved, morcellated the clot, and the patient was awake in 15 minutes, and patient was up and breathing with a low saturation of 70% back to almost 95% oxygen saturation if a PE is actively treated. So here is a center of excellence of radiology where I would like other people from the country to come and learn. We have a residency program, as well as people can come for observership and improve their skills. It's not only for our 4 walls that what we do. If we have certain expertise, we would like to share with the others. We have also conducted deep brain stimulation surgery for Parkinsonism and successfully treated the patients, which is a very, very subspecialized surgery for neurosurgery branch. Our lab services are extremely cost effective. Our lab testing is not very expensive, and we provide the results on the same day, and our lab is quality controlled where every result is checked and rechecked. And we do have a very efficient service of providing the results in a short span of time. The doctors can access the reports, as well as the patients are given the reports in a quick time frame so that they can have the efficient follow-ups. Now, pharmacy services. Pharmacy services, one thinks that they're not that important, which is the most challenging job, is to acquire the drug from the right source at the right price, is stored at the right temperature regulation, that the efficacy of the drug is not destroyed according to the regulations of the country, that you are not giving substandard medication, you're not giving any medication which is not procured through a reliable source, which is not temperature controlled, because unfortunately in Pakistan a lot of drugs are available through smuggled sources where you do get the drug which has not been temperature regulated, and the drug tends to lose its efficacy. So we do have a pharmacy which is extremely reliable, which provides good quality drugs at almost MRP levels, and we do manage our procurement and all through very reliable sources. The ambience of the hospital is very close to my heart. Maybe that's a personalized thing, but now patients do appreciate what is good for me. It's a feel-good factor when you enter the hospital. If you see healthy greenery, if you see water body or a pond, if you see live fish happily moving around, that also has a soothing feel-good factor. If you get a good decent cup of coffee or tea with a good biscuit, so food service is equally important. What is the experience? A patient waiting for 2 hours has an access to a good restaurant in the hospital, adds on to the value addition and overall experience of the patient. I mean, I'm very happy to see mums coming for their waiting time. If they have a long wait at the school, they would come and have a cup of tea or coffee, or patients' relatives coming for a meal, or kids going for a meal with the family, or a mother who's had surgery coming down to the restaurant and having a decent meal with her children, meals made to order for the room service or in the restaurant. So these little facilities do add on. Gardens are looked after by our local gardeners, and I think gardening is one of my personalized passions apart from healthcare. So our gardeners are committed and they look after the garden like our children all around the year. Each plant is documented, and I think I'm the personalized policewoman chasing each and every plant, that my plants haven't died or they're well looked after. Housekeeping and security services are excellent. Our housekeeping services are as good as any international standard. The disposal of waste units, the provision of clean toilets for the staff as well as for the patients is extremely important for us, because hygiene is one of the basic things, that you get a clean bed sheet, clean bed linen, which is not used from one patient to the others. The patient's clothes, they are properly washed at proper temperatures with proper detergents. It's a very scientific way of looking at provision of healthcare services, that your housekeeping, how they are mopping, how they are using the vacuum cleaner, how much is the noise control in the hospital, what are the domestic cleaners doing, are they treated with respect, and do they take pride in their job or not. That's all very important. Lastly, the most difficult task is of the security services. At times it's very sad to see people bribing the security guards to allow them to go upstairs, or to abuse them, or to shout and yell at them that, don't you know who I am? The security personnel are just following the rules. They are just doing their job, and they are really respectable boys who have a very difficult, challenging job, looking at such a huge turnover of patients and managing the law and order and peace in the hospital environment. Luckily, we have not had any accidents, although we have had incidents where our security has picked up the pickpockets or people who come there with not a clean intention. So security is absolutely essential, that there's no theft, there's no burglary, you feel safe in an environment. Unfortunately, in Pakistan, we do have to look after that aspect. So I think each and every person working in the hospital is as important as I am or a consultant is. Like, I would say that my cleaner in the hospital, a housekeeping ward boy, is equally important as the CEO of the hospital, because everybody has to do their job and everybody deserves the same amount of respect. And we need to have respect for the nurses, for our colleagues, for our helping staff, because it's a teamwork at the end of the day. It's not one person delivering good healthcare. It's a teamwork. It's overall experience of the patient that matters. So we have to continue with this teamwork. Lastly, I'd like to add on to our vision, like we are planning to expand our services. We have done our branding. We are giving our franchise all over the country. Whoever wants our franchise, so far we've given 2 franchises, and I'm also working on taking our services abroad. If Cleveland can come to Abu Dhabi and King's College can come to Dubai, we can also go abroad and expand our services and share our good name and our experience and contribute to the international society. Thank you.